Hi, welcome back. How have you been feeling?
Been feeling good.
Excellent.
About 1 million Americans have inflammatory bowel disease, with as many as 100,000 being children.
What piece of advice do you have for somebody else who is just being diagnosed?
The disease can be especially tough for children to bear. Young patients, who are still developing a sense of themselves both emotionally and physically, must face an extra hurdle of having a chronic disease, a disease that can cause persistent diarrhea, abdominal pain, intestinal bleeding, fever, and weight loss.
Are there any things that hurt your stomach?
Not a lot.
As a result, inflammatory bowel disease can affect school attendance, the ability to play sports and other activities, even something as simple as the willingness and confidence to sleep over at a friend's house.
These diseases affect so many aspects of the child's life. The psychology, the social things that are going on that are being impacted because of their disease, or their growth, and that's so important. We only have one opportunity to make them grow. It's all important.
It's easy for parents to feel helpless if their child has the disease, but it's also challenging for healthcare providers to treat. Often, the disease can differ from one patient to the next. Due to the nature of the disease, the Pediatric Gastroenterology team at Boys Town National Research Hospital takes an interdisciplinary approach to the care of their patients.
There are things in here that teach you about what's good to eat.
So we're having our dietitian review the charts with us before they come in. We've involved our child life specialist, so many of our patients have an opportunity to develop a relationship with yet another person here at Boys Town that's part of the team. And by involving all the different disciplines to treat that child, we're really meeting all of the needs outside of their gastroenterology needs.
That collaboration has gone further. In fact, it's gone national. The Pediatric GI team is a partner in the ImproveCareNow network.
ImproveCareNow is a national collaboration of doctors and nurses, dietitians, psychologists, parents, and patients that are working together to improve outcomes for children and adolescents with inflammatory bowel disease such as Crohn's disease or ulcerative colitis.
The network consists of 750 pediatric gastroenterologists caring for more than 24,000 children in 85 care centers located in 36 states and England. The concept is pretty simple. Medical care is better when health professionals share information. Thousands of patient visits are analyzed, the latest studies and treatments are reviewed, and the information is shared worldwide. The result is improved patient care.
There are individuals out there that have lots of different experience levels when it comes to caring for these kids. It is, have they ever seen somebody with this particular presentation? What happens when a child responds or doesn't respond to a particular medication? I have the opportunity to find out what is working for other institutions, to be on the cutting edge of research opportunities.
Traditionally, doctors have been sort of on their own, in their own little silo, doing the best they can. But with collaboration, we find out really how we're doing, and we learn from each other. If somebody has a good idea, then we get to benefit from that idea.
But ImproveCareNow is not simply for providers. It's an important resource for patients and their families.
They're the first ones who decided we need the parents on our side so that we have a completely different perspective. We go home and we deal with this every single day, and we go through the ins and the outs and the pains and our kids crying and feeling awful. Being a patient partner means that I'm able to work with the doctors here and really provide a kind of great different perspective. It's a cohesive group effort to provide all of that care to make our own lives at home just a little bit better.
It helps us to have a very family-centered approach to the care of these patients. It empowers them. It gives them the opportunity to feel like they know that they are contributing back to the medical community, and they're also obtaining good benefits from the ImproveCareNow network.
Take some deep breaths.
The results of ImproveCareNow have been astounding. Within the network, 80% of patients are in remission, with 50% sustaining remission for at least 1 year. 93% have satisfactory growth, 90% are showing satisfactory nutrition, and 95% are not taking steroids.
Been eating okay?
Yeah.
The Boys Town Pediatric GI team has seen similar success firsthand.
I think Riley has a much better standard of care now. We've really been able to control his symptoms, which leads to a better quality of life. He's been able to play sports again, get out there, swim. He doesn't have as much pain, and when he does have pain, it's promptly taken care of. Now that the parents and the patients and the doctors are all involved together, and the fact that he knows what's going on with his own body and his own care is really important.
We've already talked about how well you are growing now, now that we know what's wrong and that we're treating it, and that's what we want.
The mission at Boys Town National Research Hospital is to change the way America cares for children, families, and communities. Utilizing tools such as ImproveCareNow helps the Boys Town GI team further that mission and is another example of healthcare collaboration at Boys Town National Research Hospital.
It's just a different way to look at care. It's a way to move care forward faster, and this is a way that we can stay ahead and stay with what we're seeing across the country.
I'm really glad that we're part of ImproveCareNow because I think it validates the quality of our care and helps us be better physicians for these children.
We're able to provide efficient care that's comprehensive, cost-effective, and reproducible to allow for the patients to improve and have the best outcomes for the rest of their lives.